नमस्कार, मेरा नाम डॉक्टर जोशिता पंता है। मैं फोर्टिस हॉस्पिटल मेडिकल सर्विसेज टीम से डिप्टी मैनेजर हूँ। आज हमारे साथ डॉक्टर सोनल कुमता ज्वाइन कर रहे हैं। वेलकम मैम हियर।
नमस्कार।
Thank you for joining. So, Dr. Sonal Kumta is our senior consultant and a full timer working with Fortis Hospital for last 20 years, and she has been here in OBGY department. So, ma'am, we have a lot of myths coming up in pregnancies. कहते हैं ना, जितने ज़्यादा लोग उतने सारी बातें. So there have been lot of myths that we would like you to clarify to our viewers.
Okay.
So first of all, this is like what we call about start time and very fast running time. So what is the teen pregnancy? Is there any high rise in it? What is your point?
Definitely, the current generation is sexually active much earlier, and a lot of them are aware, and they do come to us for guidance even before they want to be sexually active. So there are two important guidances we give them. One is how to prevent a pregnancy. See, we can't be moral police for them.
Right.
If we tell them don't do, that's not acceptable. So what we guide them is, one, how to prevent pregnancy, and the second is how to take care of your body and prevent sexually transmitted infections. But yes, we are seeing a lot more youngsters coming with pregnancies, and more often than not, they want to discontinue it or terminate it. So we help them with that process too.
Right. So ma'am, second question, or the myth I would say, is that the twin pregnancy is very rare.
I would not say very rare. Yes, when you look at general population,
Right.
the number of single pregnancies and number of twin pregnancies, definitely twin pregnancies are much lesser. But nowadays we are seeing a lot of patients who are getting pregnant with the help of fertility treatment. So whether it is medications, ovulation induction, certain techniques like IUI or IVF, test tube baby treatments. So definitely the chance of twin pregnancies have gone up significantly.
Right.
And at Fortis, we being a tertiary care center, and we being a large hospital where there are multiple specialities, we have the advantage of having a blood bank, an ICU backup, and neonatal intensive care unit. So we do end up seeing a lot more high risk pregnancies.
Right.
So a lot of patients who have twin pregnancies will have some or the other difficulties or complications, and hence we end up seeing a lot more twin pregnancies.
Understood.
Today.
Great. So ma'am, okay, there is one question, that is, heartburn means that the baby will have a lot of hair.
Oh my God!
Yeah.
Really?
Right.
That I don't know about that, but I definitely deliver a lot of babies, and I see some babies having a lot more hair than the others. So I'm going to go back and ask their moms.
Right.
But from medical point of view or from medical science, I don't think the two are really connected. We cannot explain heartburn to cause excessive hair or more hair on their head.
Okay, ma'am. So one more question is it possible to determine the sex of the baby without the radiological intervention?
No, I think it would be very difficult to determine. I mean, I don't know how one can know the sex of the baby. As far as the Indian context,
Yes.
The government of India or our Indian laws, we are not allowed to disclose the sex of the baby, and we do not do any sex determination tests or practices in our country.
Right. Great. So ma'am, one more question. A woman should eat for 2 people when she is pregnant.
Okay, this can also be a myth.
Okay.
Now, yes, a woman's appetite will go up. Let me start from the beginning. In the first 3 months of her pregnancy, that is her first trimester, she's typically having a lot of nausea, vomiting.
Right.
So her appetite has completely gone. She's lost her taste. So she actually ends up eating less. And that is the time I counsel not my patient but her family members.
Right.
Because the moment they find out she's pregnant, they want to feed her. So in the first 3 months, we have to just leave her alone because she just doesn't have any appetite. But the next part of the pregnancy, from the 4th, 5th month onwards, I agree that her appetite is definitely going to go up. But there is no need for her to eat for 2 people. I recommend to my patients that they should just eat a normal, healthy diet and eat at frequent intervals. Very often they are not able to eat a whole meal at one time. So I tell my patients, you can break your meal into smaller parts and eat something at every 2 to 3 hour interval. That way they can remain satiated and they don't feel too much of discomfort or bloating by having a large meal.